guys, I'm here at Gladstone Community Health Service, and today we're going to be taking a sneak peek into the lives of occupational therapists who work here in Gladstone. For those who don't know, Gladstone is about 6 hours north of Brisbane. It's a beautiful part of the world, so let's get to know occupational therapy. Come with me. I'm Dana, and I work in paediatrics, so I see children aged 0 to 5 or up until entry to school who have developmental delays or are at risk of developmental delays.
And I'm Lana, and I work in peds as well, but I am a bit of a generalist and see a few hand therapy patients, burns if I need to cover the ward if they're stuck. So I'm the gap filler, really. I guess our aim generally is to provide the parents with the tools to help their child to overcome whatever issues they have.
Some of that I think is just supporting the parents in understanding why their child is presenting that way, and even if we don't change how they're presenting, I think sometimes having that understanding can help.
My role is OT on the ward, so the inpatient setting. Okay. So that's the medical and surgical ward here. Also hand therapy and community outpatient, so your home visits and things like that, or your equipment prescription. Doing a split caseload especially, so being between two places. But it's a good experience, to get exposure to all the different areas of OT. Yeah.
I'm Robin McMillan. I'm an occupational therapist here at Gladstone Hospital. I work both on the ward and here at Community Health and in the cancer care roles. I do see a lot of ladies with breast cancer and providing education to prevent lymphedema. So that's where Galen Breast Care Nurse and myself, we work together with some absolutely wonderful ladies out there that are going through a very difficult time. And I also do teach the basics of massage, self-massage to anyone with lymphedema, because we also see a number of patients with head and neck lymphedema, post head and neck cancer, surgery and radiation. I work on the ward a lot, and part of my role is coordination, so making sure that the patients are linked in with members of our allied health team, like the dietitian, the physios, social work, speechy, therapists, and so lymphedema prevention, scar management, shoulder range of movement, but also providing some emotional support as well, and linking them in with some of the services that are available in Gladstone.
I work for Transition Care Program, which is a nationally funded program by the government, and it's a program for older adults who have been in hospital and are looking to return home but need a further bit of rehab at home to get back to where they were before they went to hospital. So that could include anything from physiotherapy weekly to occupational therapy, which looks at functional tasks, whether it's showering, preparing a light meal, dressing, as well as home modifications and equipment that they might need, whether it's some grab rails or a toilet frame. And they're also nursing support for any wound care or if there's any incontinence. And then we also look at services, so shopping, showering, transport, those sorts of things. Yes. And it's very rewarding to be able to support people to be in their home, and which is ultimately where they want to be.
I'm Alison and I'm an occupational therapist at the Child and Youth Mental Health. So I see kids aged between birth and age 18, and my role here is as a case manager. Mostly I would see children with a severe or a complex mental illness. So that's things like severe depression or anxiety or post-traumatic stress disorder, but where there's a really big impact on someone's day-to-day life as a result of those illnesses. That OTs are really good at looking at people's everyday lives and what people do as activities and what people do to look after themselves and keep themselves healthy, and I think mental health fits really well into what OTs do.
My name's Penny. I'm an occupational therapist on the case management team at the Gladstone Integrated Services, and employed as a mental health clinician. Well, as an occupational therapist, we look at daily living and a person's ability to perform all those tasks within their daily life, and that can be any role at any age from 18 to the elderly. It can be being a worker, it can be being a mother or a father, a brother, a sister, student, but it's the impact of that mental illness and the symptoms that may affect their ability to do the things that they would normally do quite capably. Seeing person as a holistic, you're working on a holistic approach. You're not just seeing person with a broken foot or a definitive part of them. It's the whole part of them that works and functions in day-to-day living, looking at how the challenges of solving a problem with them could be rewarding, and also helping them to achieve their goals. And some goals are quite complex and some goals are simple, but as an OT I feel it gives you that scope to be creative and also think outside the box sometimes, and you're also gaining a lot of input from the person and information from the person that you're working with as well. So I find occupational therapy a really challenging career.